According to Bizimana, Uganda shouldn't lament the potential challenges faced by HIV/AIDS patients following the recent statements by the former US President Donald Trump regarding aid to developing countries. Instead, he emphasized that the government should focus on the self-reliance by leveraging the Consolidated Fund to enhance the healthcare services.
Must be a substantive responsibility of the Consolidated Fund so that we don't get these shocks. I believe that we collect taxes. And why should Ugandans depend on foreigners, on the health of its own people? If our budgets cannot support the health budget, then who are we supporting? Sometimes when I say this, they say, is Bizimana not an opposition? But we also track funding from our taxes and other sources of funding. And when we track the funding of healthcare and the budget that goes to our health, and you find that the proportion coming from Consolidated Fund is too tiny.
At the same event, judicial officials and the representatives from the Uganda AIDS Commission reaffirmed their commitment to curbing the spread of the HIV/AIDS in the country.
To show our commitment, the Judiciary has embraced guidelines to fight HIV, and among the achievements in the implementation of the HIV/AIDS activities. These include 1. Allocation of resources for implementation of HIV/AIDS activities. 2. Development and sensitization of the staff on the Judiciary HIV and AIDS workplace policy. 3. Medical financial support provided on quarterly basis to staff who declare their HIV status. 4. Effective referral of staff identified to be living with HIV, access ART. 5. Increased awareness on HIV.
We have had a 12.9% reduction in HIV prevalence from 18% recorded in the 1990s to 5.1. So that's a 12.9% reduction. We have had 61% decline in new infections since 2010, and we have had a decline in deaths, in AIDS-related deaths, by 57%. In terms of the 95 targets, where we say 95% of the population should know their HIV status. And
local authorities also stressed the importance of the collaborative efforts to improve the health care at the community level.
As members of the Judiciary, you play a vital role in upholding justice, promoting human rights, and serving the community. Ladies and gentlemen, and honorable members of the Judiciary, AIDS is a public health concern that affects not only individuals, but also families, communities, and societies as a whole. It is a disease that knows no boundaries, affecting people from all walks of life, regardless of their social status, economic background, and professional. As judges and magistrates, you are critical role in addressing the socio-economic impact of AIDS.
Kabale District has offered this land where we have these offices. And sometimes back, we even requested to have Court of Appeal here in the Kabale Chigezi. And you are ready to give more land. So Kabale and Judiciary, we work hand in hand. So I will not talk much, only that I want to thank you for initiating this and inviting us.
According to the latest statistics from the Uganda AIDS Commission, Uganda has 1.49 million people living with HIV, with a prevalence rate of 5.1%. In 2023 alone, the country recorded 38,000 new infections and 20,000 AIDS-related deaths. Young people aged 15 to 24, particularly adolescent girls and young women, remain the most vulnerable demographic.